This is Melissa Gray, Program Manager with the National Aging and Disability Transportation Center. I would like to welcome you to this session on volunteer transportation, keys of a successful program. I am excited to introduce Noreen Doherty, Program Planning and Evaluation Analyst with the Sonoma County Area Agency on Aging, located in Santa Rosa, California. Noreen received her BA in psychology from the University of California, Santa Cruz, and her master's in public health with a concentration in community health education from San Jose State University. In January 2013, Noreen started working for the County of Sonoma Department of Health Services as a Health Information Specialist too. During this time, Noreen coordinated the Safe Routes to School program. In October of 2015, she accepted a position with the Department of Human Services Adult and Aging Division as a Program Planning and Evaluation Analyst. Currently, Noreen manages the Area Agency on Aging's transportation and mobility programs for older adults and people with disabilities. Prior to her work with Sonoma County, Noreen worked for the County of Santa Cruz Department of Health as a health educator at Juvenile Hall, as well as a grant writing consultant for a consortium of community health centers in Santa Clara County. I am delighted that Noreen is here to share her valuable experience on this topic. Now I would like to hand things over to you, Noreen.
Thank you, Melissa. Hello, everyone. My name is Noreen Doherty, and yes, I am a Program Planning and Evaluation Analyst with the Sonoma County Area Agency on Aging, which is located in Santa Rosa, California. So where are we? We are located within Sonoma County, which is one of the 9 counties that make up the San Francisco Bay Area. And we're located about 50 miles north of San Francisco. Here's a little overview of our demographics. Sonoma County is home to a very large older adult population, with 25% of our population being age 60 and older. The Area Agency on Aging, or as we know, the AAA for Sonoma County, is under the Adult and Aging Services umbrella within our Sonoma County Human Services Department. The Sonoma County AAA offers many different services, but of course today we will be focusing on transportation. Sonoma County is quite large compared to some of our neighboring counties. Sonoma County is also very geographically diverse with a mix of rural and suburban areas. You can see on this map that there are some areas of our county that just really are not served by any major highways. So we do face challenges in serving our homebound and geographically isolated community members. So to address the transportation barriers and challenges of our county and the needs of our growing older adult population, the Sonoma County AAA has a vision of coordinated transportation services. Our vision is to have volunteer driver programs throughout the county. Currently, our volunteer driver program consists of 4 nonprofit agencies, with 2 new agencies coming on board once we do receive approval from our funder, Caltrans, for their contracts. Our volunteer driver services are curb to curb. However, volunteers do use their discretion for providing a door-to-door service. Drivers do use their own vehicles and gas. They are reimbursed for mileage, however. Our program did begin in 2008, and we're actually gearing up for our 10-year anniversary celebration, which we are extremely excited about. And in this last fiscal year, we provided close to 20,000 trips. To support our programs, the Sonoma County AAA began leveraging Older Americans Act dollars for transportation services beginning in 2008. And as the success of our program grew, the AAA was encouraged to apply for additional transportation grants. So for the fiscal year 2014-15 through 2016-17, we had New Freedom Cycle $5 to help support the expansion of our volunteer driver programs. In addition, we did apply for Caltrans 5310 funding and were awarded $388,975 to be spent during the fiscal years 2016 through 2018. And then most recently, we applied for and received a Caltrans 5310 funds for 2018 through 2020 for the award of $444,507. And we do include a local match and in-kind services when required, of course. Regarding long-term visions of sustainability and innovative ideas for funding, we have learned that it is really important to work with your local transportation authority. For example, about 2 years ago, we were in conversations with our local transportation authority about exploring the leveraging of a local transportation sales tax, Measure M, for older adult transportation services. This approach was actually looking very promising. We had lots of different meetings, and we were in the process of developing documents for the public and proposed budgets. However, unfortunately, we did have a very large firestorm in 2017 that really devastated a lot of the resources within our county. So this opportunity became no longer available for the need to divert funding towards recovery of road repairs. But identifying a sustainable source of funding does continue to be a long-term goal. And within our AAA, we do have a committee that actually works on legislation and advocacy. So another approach we have learned regarding sustainability is really leveraging the expertise and commitment of our AAA Advisory Council members to help identify and advocate for transportation funding sources. Another approach to working towards sustainability for our programs is really promoting the value of being a good neighbor. A lot of our outreach and marketing campaigns have really tried to highlight the social aspect of the program, as in sharing with potential volunteers that they really can make a difference in someone's life, that they can decrease isolation of homebound seniors, and that they can be a good neighbor and contribute to the health of their community by providing rides to those who aren't able to drive. So there were several factors that led up to the launch of our program in 2008. In 2006, the AAA Transportation and Mobility Committee was formed in response to information that we had received from our AAA Area Plan Needs Assessments. This committee decided to allocate some of our Older Americans Act funding towards the start of a volunteer driver program. So in 2007, an RFP was released to identify a volunteer driver coordinator. And in 2008, the volunteer driver program was launched. From there, the committee work grew, and after attending the National Center for Senior Transportation Conference in 2009, our Transportation and Mobility Committee members became even more motivated to increase coordination and expand services. The AAA began to look at additional transportation funding sources to support this vision as well. So this slide shows a list of our current and upcoming volunteer driver partner agencies and the years that they have been included in the program. As you can see, the Sebastopol Area Senior Center was our very first program, and we were very excited to celebrate their 10-year anniversary. So that'll be coming up in the next few months. So when we talk about transportation mobility, we have to talk about partners, of course. Can't do this alone. So the AAA, or the Sonoma County AAA, does bring together advocates, community partners, and service providers to advocate, engage, coordinate, and educate the community and other service providers in efforts to increase transportation access and services. The AAA Transportation and Mobility Committee began in 2006, as I shared, and does bring together service providers and AAA Transportation Mobility Committee members on a monthly basis. The role of the Transportation and Mobility Committee is to coordinate services among service providers, share best practices, and discuss challenges, and identify areas to focus on, as well as areas that we want to expand. The Sonoma Access Coordinated Transportation Services Consortium, otherwise known as SACS to us, began in 2011. And this consortium casts a wider net to bring together a larger group of partners on a quarterly basis. The role of the SACS consortium is similar to the Transportation and Mobility Committee. However, this group tends to focus on larger, more regional challenges and efforts. And finally, the AAA Advisory Council Committee, our full committee, is the oversight body to the AAA Transportation and Mobility Committee and addresses a broader array of senior services. This slide gives some examples of the types of activities that the Transportation and Mobility Committee, as well as the SACS Consortium, conduct. We have hosted travel trainings, educated the community at large about regional efforts like the Bay Area Clipper Card. We host presenters, including representatives from our 3 transit agencies, Lyft, and our regional transit or transportation partners with the Metropolitan Transportation Commission. Our volunteer driver program does fit into our broader community transportation efforts by providing coordination and collaboration with other agencies. The Sonoma Access Coordinated Transportation Services, the SACS, is not only a consortium, but is also a comprehensive planning initiative to create a collaborative strategy for public and private transportation service delivery that serves the needs of older adults and people with disabilities. Our vision is that by 2020, the work of the SACS will result in the improved availability and awareness of socially equitable and easily accessible systems of sustainable transportation options. So through the creation of the SACS Consortium, we have successfully brought together over 80 individuals, including county organizations, concerned members of the public, our 3 fixed route transit agencies, local health, disabled, and senior service providers, just to say a few. The consortium works together to identify ways to coordinate transportation options, create an inventory of services, identify gaps and barriers, and strategize on how to overcome those barriers. Of course, no volunteer driver program would be successful without our volunteers. So we do devote a decent amount of our time and resources towards outreach and marketing to recruit volunteers and promote the program. Really, we have found that recruiting volunteers can be challenging. However, once they are on board, retention has been very high. Actually, feedback from our partner agencies indicates that once they find a volunteer interested in this work, this volunteer really commits to the work. We've heard great stories of volunteers developing friendships with their riders that go on for years. And we have some volunteers that have actually been driving since the program started 10 years ago. So it's pretty heartwarming. So outreach efforts that we have conducted include tabling at events and fairs for recruitment. We've done presentations at social clubs like Rotary and Kiwanis clubs. We've conducted presentations to elected officials at our county board of supervisors and city council members. We work to really build our relationships with senior center members and staff. We've hosted events to celebrate volunteers. In addition, the AAA does presentations, I do presentations internally to our staff of social workers. We've done internal promotion of our program on our internal intranet for our human services department. So we really increased our what's quote unquote our in-reach, just to make sure our social workers and all of our staff are aware of this resource. Another outreach effort was promoting our programs to the North Bay Realtor Association. We've learned that realtors actually are great as volunteers for drivers because it's a really good way for them to observe new houses on the market and learn neighborhoods. Let's see, and then public messaging and social media is another great way we work to conduct recruitment for volunteers. AAA has developed canned messages that we share with our volunteer driver programs to promote their programs regionally and through their individual agency social media platforms. We do share quarterly aggregate ride number data with our volunteer driver agencies so they can promote the message of being a part of something bigger. We do recognize long-term volunteers for their 100th ride or their 100th mile driven. We've created a variety of social media campaigns, including a favorite roads campaign for Facebook, where people can post or tag people on pictures of their favorite roads throughout the county. We've also engaged local celebrities, mayors, members of our board of supervisors to give a ride so we could take photos and use in our marketing materials. And then we also collect and incorporate quotes from riders and drivers into marketing and messaging. Speaking of messaging, we did create a countywide branded flyer that includes all of our agencies to help with our promotion as well. Of course, we ensured the flyer was accessible for individuals with low vision or vision loss. And the flyer is intended to be dual purpose to connect messaging and campaigns, as well as to promote the program to the broader public. Let's see. And yet another, oops, here we go. And I wanted to show folks a copy of our flyer. So as you can see here, it is a dual purpose. It is promoting giving a ride for volunteers as well as getting a ride. We did include all of our agencies on here and their logos, so they are represented, but it is branded with our county aesthetic. And as you can see, we also incorporated quotes into the flyer, which I believe adds a nice feel to it. Yet another method of outreach and recruitment is through the leveraging of our Sonoma Access website. The Sonoma Access website, it provides a one-stop location for existing transportation resources through Sonoma County in the North Bay. And actually a volunteer can sign up to be a driver through this website as well. In addition, by self-navigating this website, users are connected with agencies providing transportation services to identify options that will meet their specific needs. So it's a win-win. Yeah, so once we have the volunteers, of course, with any program, we do need to consider the areas of risk and liability in working with the public. For our program, all contracted nonprofit agencies actually provide their own liability insurance that covers their own volunteer drivers. In general, policies that govern our programs are taken straight from regulations from our funders, including the California Department of Aging for our Older Americans Act funding, as well as the Federal Transit Administration for our Caltrans funding. However, as a consortium of providers, we have had to develop some of our own agreed upon policies. So basically, when an issue arises with a service provider, we do expect that service provider, our partner agency, to bring that issue into one of our monthly transportation and mobility meetings to discuss with the group. From there, the group seeks ways to develop unified messaging and talking points that each provider can refer to. So for example, all agencies have a 5-day advance notice for a ride request. All agencies provide no more than 2 rides a week to the same person. Those are just a few examples of agreed upon policies. Another important way that we've learned to mitigate risk is by doing very thorough trainings with the volunteer drivers. All of our partner agencies are required to deliver a minimum 4-hour training to new volunteers with annual booster trainings as needed. And our partner agencies train volunteers on things like helping people in and out of the car, dealing with medical emergencies, and working with mobility aids. And so in order to ensure the success of our program, we do, of course, collect, analyze, and report on our program data. This is in efforts to identify areas of growth, areas of success, as well as to promote the program values to the community at large. We collect data on the number of rides provided, the number of people served, as well as the trip destinations. Of course, we have found that healthcare is the most frequent destination, and we do use this data to be able to advocate for resources. Of course, using this data when writing grants has been extremely helpful and supportive. But in addition, the Transportation and Mobility Committee has a goal of developing educational materials that really highlights the types of trip destination information, and then using that as an advocacy tool to approach a hospital or a healthcare system or a dialysis provider to use for leverage for additional funding. Data is collected on a monthly basis through the trip planning software that we use to schedule rides. It's called Assisted Rides. And we're also able to pull reports from this software, which is great. Partner agencies also send in monthly paper reports of aggregate data as well, but they're very simple one-page reports. So we measure impacts, as we just talked about, through data collection by means of collecting service units, but we also ask riders for their feedback on evaluation forms, and we regularly check in with volunteer drivers for their feedback. Program outcomes are shared in a variety of ways. For example, I mentioned we will be hosting a widely publicized celebration event this coming January to highlight the 10-year anniversary of the start of the volunteer driver programs in Sonoma County. We do request quotes and success stories from our drivers and riders on a periodic basis that we include in our marketing efforts as well, as you saw in our flyer. And when I went over the outreach and recruitment strategies earlier, I did talk about our different marketing strategies and social media campaigns, but this is also a way that we share the impact of our program with the community, not just using these methods for recruitment. Lastly, we've developed press releases, and community partners along with myself do conduct stakeholder and community presentations on a regular basis. Here is an example of an article that got picked up earlier this year after sending out a press release around the holidays, really leveraging the giving season message, encouraging people to give back to their communities. So yeah, we definitely consider that a success. So that concludes my presentation, and I'm happy to stick around and answer any questions that you may have. Thank you for your time.